budget transfers for Gregg County. What exactly was approved today?
Well, so as you know, we're approaching 1st of August, so a couple of months left in the current budget year. Based on jail operations and jail needs, it became apparent that we need to transfer some funds to make it to the end of the budget year. So we moved some money for repairs and maintenance of the building. We have to repair the HVAC heat system in part of the North Jail before it gets cold this fall. And then the other part went for hospital for inmates.
What repairs exactly need to be done?
Well, as I say, we've got a chiller boiler system in part of the North Jail facility. That's our large jail with just under 700 beds on the northwest side of the courthouse. And so we actually just spent about $68,000 this year on the chiller air conditioner system, and now the cost of repairs to the boiler system is about $70,000. We're going to be able to do those before October 1st in this budget year, and then we'll be good to go as we get into the fall and the cooler season.
And what exactly, just for some clarity, what does group health insurance cover, and how will this transfer impact that?
Well, where we transferred it out of was operational funds. Group health is the benefits for the staff members, so we're using salary and benefit lag, in this particular case, benefit lag, to cover the additional cost in operations within the jail budget.
You mentioned salary lag. Just to be clear, I know there's been some talk about overtime costs with the jail. Does any of this have to deal with overtime?
No, this is actually repairs, and this is inmate hospital charges. Is where these funds. We have transferred money before, as you've reported and you're aware, to cover overtime costs. We do have those covered. We did not transfer from salary lag simply because, if you'll recall, last month the county voted to approve a buyback plan for the holiday time. So we left the salary lag in place to cover those costs. We were using benefit lag to cover the cost of jail repairs and operations.
Now, I know when we were talking about the holiday pay, we were talking about, several $100,000 in liabilities for the county. With this, this is $250,000, which is, more than is often put up at Commissioners Court. So is that amount of money, what were you all surprised by, by that amount?
Okay, so let's break that down. 125 is going to repairs. Well, so 70,000 is to the heat and air system, okay? And then the other part of that is for other assorted repairs that we have identified that can be done in this budget year rather than budget for it next year. So that's what we're doing. The hospitalization and the hospital costs for inmates just depends on how many inmates we have that have to go to the hospital. And I'm going to tell you, while we budget for that, it's difficult to budget for the number because you get a very sick inmate or a bad year, and we've had a couple of those with a couple of sick inmates that the cost exceed what the budgeted funds are.
Are those select sick, those inmates who are particularly sick, is that what really led to this request, or was there another reason to put this forward?
Well, in this particular case, I think you'll also remember, because you reported on this, that we had an inmate that required open heart surgery. He then required to be taken to a LTAC facility, which is a long-term acute care. All of those things, weeks and weeks in the hospital and at different care facilities, will bust your budget without fail.
You witnessing, or dealing with an increase in hospital costs, and how's that impacting, the work you do?
Well, the last 2 years it's been very difficult as we've exceeded our hospitalization budget. We've exceeded some of our health care funds that we budgeted, and so all we can do, we have to continue to provide medical care for these inmates, and It's at an expense to the county. It's what we have to do, and it's what we're going to do. We're just fortunate enough to be able to have budgeted funds and then move those wherever the costs are so that we can cover the cost of that without having to come back to the commissioners and ask for additional funds. What we're doing is moving money that's already been budgeted for sheriff's operations within the sheriff's operations and jail operations to meet those needs.
Let me ask you, in the upcoming budget or future budgets, do you see yourself asking for more money dedicated to hospital costs?
Well, you know, I can tell you that we budgeted $475,000 for the FY26 budget just for hospitalization. That doesn't include our professional costs for doctor and mid-level that we contract with. It doesn't include the medication that's provided in the jail, which is another $300,000 a year. So there's already a large amount of funds that are expended there, and we have certainly not decreased what that budget is.
And with these transfers now being approved, what impact do you feel it's going to have overall in the sheriff's office?
Well, it won't have an impact in that those are funds that were budgeted for benefits of staff members that we haven't been able to hire, so it's called benefit lag. And so we're rerouting that money to cover cost of building repairs and cost of inmate health care. And so it has a zero impact on the budget. And we only use those funds to meet budget deficits in other areas.